Recurrent pregnancy loss as defined by RCOG guideline 2011 means when there is loss of 3 or more consecutive pregnancies before 24 weeks of gestation. Age of mother has a very important role when we talk about miscarriages. If the woman age is between 40 to 44, the risk of miscarriage is almost 50%. And if the age becomes 45 and above, almost 90% of the pregnancies they miscarry. So I'm going to show you a very important table. So this is a very important chart depicting age-related risk of miscarriage. We can see here, and all these numbers, they are very important. The risk of miscarriage is least when the age of the women is between 20 to 24, when it is only 11%. At the age of 40 to 44, the risk of miscarriage is 51%, and if the age is 45 and above, almost 93% of the pregnancies they do miscarry. So this chart is very important. All the numbers are very important in this chart. Then we have this chart which shows how the epidemiological factors they affect the recurrent pregnancy loss, the risk of recurrent pregnancy loss. So there are various factors which they have told, like alcohol, caffeine, exercises, family history of pregnancy loss, previous history of pregnancy loss, maternal age, paternal age, occupational or environmental exposure, smoking, stress, and maternal BMI. So they say that alcohol and caffeine, they have not found to have the evidences do not show that they are a direct cause of RPL, but yes, you should always take a moderate amount of coffee and alcohol. Exercises, high intensity exercises, definitely they pose a risk on RPL. Family history of pregnancy loss, definitely if there is a family history of miscarriages, then a woman is more likely to have miscarriage. Thereafter, maternal age, we have already discussed how maternal age influences the miscarriage rate. Occupation, though there is no evidence that it directly is a cause of RPL, but yes, we should always avoid exposure to hazardous substances during pregnancy. Paternal age, particularly if the father's age is above 40, then the risk definitely increases for RPL. But it has less profound effect when we compare it to a maternal age. Previous pregnancy losses, with each pregnancy loss, the chances of having future miscarriage, they increase. Smoking and stress, there is no evidence that they are a direct cause of RPL. But yes, stress can occur because of RPL. So this is the RPL. If the patient is suffering from recurrent pregnancy loss, she can have stress. And smoking as such, it has poor obstetric outcomes. So definitely the smoking is discouraged during pregnancy, though it has no effect on RPL. Weight, talking about weight, if BMI is more than 25, then the risk of RPL definitely increases, and it is also associated with other obstetric complications.